Hello, this is Anna Owens. This is Nursing 201. What we're going to discuss right now is conductive hearing loss. Let's look first at this picture that's a comparison of conductive versus sensorineural hearing loss. Conductive occurs when sound waves do not reach the inner ear. So there's a problem with the conduction of the sound waves through the ear. Sensorineural is when the sound waves are not processed. So it's a problem with the actual organ of hearing. Common causes of conductive hearing loss is any inflammation process or obstruction of the external or middle ear canal by cerumen or foreign objects. Inflammation process can be chronic otitis media. Causes of sensorineural hearing loss is loud noises, those ototoxic drugs that we discussed in the assessment video, aging, which is presbycusis, atherosclerosis, hypertension, Meniere's disease, diabetes, or ear surgery. So conductive hearing loss is sound waves not transmitted to the inner ear with some of these problems. Either there's a problem with the external ear canal, the mobility of the tympanic membrane, the ossicles, something that's keeping those sound waves from moving through the system. Prioritized nursing care is making sure the patient can clearly see you when you're speaking to them, making sure you turn down any kind of extra noise like the TV if you're trying to give them instructions, decrease background noise whenever possible, make sure there's a clear light so that they can easily see you, because we know patients who have problems with hearing compensate by doing what? Looking at you and reading your lips and using those two things together to get the meaning as to what you're trying to say. So it's very important to be clearly visualized to these patients. Diagnostic test would be traditional audiometry, where you do a hearing test. Treatments would be if the problem is chronic otitis media, you need to be treated with antibiotics or antihistamines or a tube placement, which is a T-tube. Another treatment for conductive hearing loss is hearing aids. Or you can get a tympanoplasty. You can get rebuilt the tympanic membrane if that's your problem. So our expected outcome is for the patient to be able to function in society. One possible nursing diagnosis could be social isolation. You don't want to go out and eat at a restaurant because you can't hear what anybody is saying, especially with background noise. So we need to talk to our patients about that. If we look at a couple of pictures, here's a picture of when a patient has a tympanoplasty. You can see here, that's where the scar is. They open up the ear from the back. They then put a graft over the part of the tympanic membrane that needs to be repaired and sew it in. The graft can come from the fascia on the face here. Another common place I've seen them use is some skin from the forearm. Get a graft from the forearm skin, and that can be used as replacement for the tympanic membrane. Hearing aids, there are several different types of hearing aids. You can have the behind the ear, the mini in the ear, in the canal, or completely in the canal, which is the very small modern hearing aids. Make sure you review how to take care of your hearing aids. Things like don't put it in water. Make sure it stays dry. Make sure you know how to replace the battery. So there is a chart in your book on taking care of your hearing aids, so make sure you review that and you know what instructions you need to be able to give to your patients. Also, there's a chart on recovery from ear surgery, patient education. Things like you don't want to strain to have a bowel movement, don't drink through a straw or travel in the air, and you think about things like anything that's going to change bariatric pressure. You don't want to get an infection, you don't want to get your head wet. So avoid washing your hair and showering for a week. After 1 week, you want to make sure you keep your ears dry, so you want to use some cotton ball coated with some Vaseline. So make sure you understand how to take care of hearing aids, teach your patients about hearing aids, and what the effects of ear surgery are. That is an overview of conductive hearing loss. Thank you.